In this video, we will be going over practice questions on abdominal disorders. Let's begin. You examine a 59-year-old man with a chief complaint of new onset rectal pain after a bout of constipation. On examination, you note an ulcerated lesion on the posterior midline of the anus. This presentation is most consistent with A. Perianal fistula, B. Anal fissure, C. External hemorrhoid, D. Crohn proctitis. The answer is B. Anal fissure. In anal fissure, there is an ulcer or tear of the margin of the anus. Most fissures occur posteriorly. Risk factors include constipation, diarrhea, recent childbirth, and anal intercourse or other anal insertion practices. The best treatment practices for anal fissures is avoidance of the condition through adequate fiber and fluid intake, avoiding constipation, and minimizing or eliminating activity that triggers or contributes to the condition. All of the following are typically noted in a young adult with the diagnosis of acute appendicitis except A. Epigastric pain, B. Positive obturator sign, C. Rebound tenderness, D. Marked febrile response. The correct answer is D. Marked febrile response. A 26-year-old man presents with acute abdominal pain. As part of the evaluation for acute appendicitis, you order a white blood cell, WBC, count with differential and anticipate the following results. A. Total WBCs 4,500 cubic millimeters. Neutrophils 35%. Bands 2%. Lymphocytes 45%. B. Total WBCs 14,000 cubic millimeters. Neutrophils 55%. Bands 3%. Lymphocytes 38%. C. Total WBCs 16,500 cubic millimeters. Neutrophils 66%. Bands 8%. Lymphocytes 22%. D. Total WBCs 18,100 cubic millimeters. Neutrophils 55%. Bands 3%. Lymphocytes 28%. The correct answer is C. Total WBCs 16,500 cubic millimeters. Neutrophils 66%. Bands 8%. Lymphocytes 28%. In evaluating a patient with suspected appendicitis, the clinician considers that A. The presentation may differ according to the anatomical location of the appendix. B. This is a common reason for acute abdominal pain in elderly patients. C. Vomiting before the onset of abdominal pain is often seen. D. The presentation is markedly different from the presentation of pelvic inflammatory disease. The correct answer is A. The presentation may differ according to the anatomical location of the appendix. There is no true classic presentation of acute appendicitis. Vague epigastric or periumbilical pain often heralds its beginning. The psoas sign can be best described as abdominal pain elicited by A. Passive extension of the hip, B. Passive flexion and internal rotation of the hip, C. Deep palpation, D. Asking the patient to cough. The correct answer is A. Passive extension of the hip. The obturator sign can be best described as abdominal pain elicited by A. Passive extension of the hip, B. Passive flexion and internal rotation of the hip, C. Deep palpation, D. Asking the patient to cough. The correct answer is B. Passive flexion of the hip. To support the diagnosis of acute appendicitis with suspected appendiceal rupture, you consider obtaining the following abdominal imaging study. A. Magnetic resonance image. B. Computed tomography, CT, scan. C. Ultrasound. D. Flat plate, The correct is B. CT scan. Which of the following WBC forms is an ominous finding in the presence of severe bacterial infection? A. Neutrophil. B. Lymphocyte. C. Basophil. D. Metamyelocyte. The correct answer is D. Metamyelocyte. Myelocytes and metamyelocytes are immature neutrophil forms that are typically found in only the granulopoiesis pool. The presence of these cells is an ominous marker of life-threatening infection, and these are occasionally found in the presence of appendiceal rupture. Which of the following best represents the peak ages for occurrence of acute appendicitis? A. 1 to 20 years. B. 20 to 40 years. C. 10 to 30 years. D. 30 to 50 years. The correct answer is C. 10 to 30 years. The peak age of patients with acute appendicitis is 10 to 30 years. This condition is uncommon in infants and elderly adults. At either end of the lifespan, a delay in diagnosis of appendicitis commonly occurs because providers do not consider appendicitis a possibility. Clinical findings most consistent with appendiceal rupture include all of the following except A. Abdominal discomfort less than 24 hours in duration. B. Fever greater than 102 Fahrenheit. C. Palpable abdominal mass. D. Marked leukocytosis with total WBC greater than 20,000/mm3. The correct answer is A. Abdominal discomfort less than 24 hours in duration. Which of the following is most likely to be found in a person with acute polycystitis? A. Fever. B. Vomiting. C. Jaundice. D. Palpable gallbladder. The correct answer is B. Vomiting. Which of the following is true regarding colorectal cancer? A. Most colorectal cancers are found during rectal examination. B. Rectal carcinoma is more common than cancers involving the colon. C. Early manifestations include abdominal pain and cramping. D. Later disease presentation often includes iron deficiency anemia. The correct answer is D. Later disease presentation often includes iron deficiency anemia. A person presenting with colorectal cancer is usually asymptomatic until disease is quite advanced. At that time, vague abdominal complaints coupled with iron deficiency anemia, as a result of chronic low-volume blood loss, is often noted. According to the American Cancer Society recommendations, which of the following is the preferred method for annual colorectal cancer screening in a 51-year-old man? A. Digital rectal examination. B. Fecal occult blood test. C. Colonoscopy. D. Barium enema study. The correct answer is B. Fecal occult blood test. The American Cancer Society colorectal cancer screening guidelines recommend at-home procedure of collecting 2 samples from 3 consecutive specimens. Which of the following is most likely to be noted in a person with colorectal cancer? A. Gross rectal bleeding. B. Weight loss. C. Few symptoms. D. Nausea and vomiting. The correct answer is C. Few symptoms. A person with colorectal cancer is usually asymptomatic until disease is quite advanced. Which of the following does not increase a patient's risk of developing colorectal cancer? A. Family history of colorectal cancer. B. Familial polyposis. C. Personal history of neoplasm. D. Long-term aspirin therapy. The correct answer is D. Long-term aspirin therapy.